morning, one and all. The topic for today, the content series, is neoplasia. As you're all aware of, in a layman term, neoplasia is referred to as cancer. Cancer is also a very dreaded disease which is prevalent all over the world, and it is the major cause of death in all the developing and developed countries in the world. Now, this cancer origin as of today is of concern, as various theories are regularly getting updated regarding to the onset and origin of a cancer. Now, today's topic of concern will be, I will be narrowing it down to the nomenclature and classification of tumors, and later we will be continuing with the various aspects of cancers in the upcoming e-content series. Now, what is cancer? So, in a pathological way of defining cancer, we refer this condition to as neoplasia. So, neo means new, plasia means growth. So, the origin of a new growth or an abnormal mass of tissue is what we refer to as neoplasia, and the process is referred to as a neoplasm. Now, the study of all these neoplasms is what we call or refer to as oncology. Now, coming to the pathological classification and definition of a neoplasm, neoplasm is defined as an abnormal mass of tissue which is occurring or formed due to abnormal, excessive, uncoordinated, purposeless proliferation of cells even after cessation of the stimulus which evoke the response. So this uncoordinated, purposeless proliferation of tumor cells even after cessation of the stimulus which evoke the response is what we term today as a neoplasm. Now, this neoplasm is primarily classified into two important categories. The first of which is what we call as a benign tumor. As we are all aware of, a benign tumor is belonging to a non-malignant category. On the other hand, we have a malignant tumor which is classified as a cancer type. Now, today we will discuss the basic differences between the tumors and also what are the other special categories of tumors which are important during a diagnosis of a biopsy in the day-to-day practice. Now, basically, any tumor is or a cancer is a permanent genetic change which we observe in a normal cell. When a normal cell becomes mutated, we call it as a cancerous growth, and this mutation generally occurs in genes which regulate the cell growth, apoptosis, and eventually the DNA repair. Now, these genetic alterations are continuously passed on from generations to the daughter tumor cells. Now, when all these neoplastic cells within an individual tumor originate from a single cell or a clone of cells which have undergone genetic changes, we call these as a monoclonal tumor category. Now, today we will also discuss how a tumor originates. Now, before we understand the basics, we will go into a little bit intricacies of a basic tissue component. Now, any tissue is made up of a parenchymal component as well as a stromal component. Now, this parenchyma is basically comprising of proliferating tumor cells which determines the nature and the evolution of the tumor. Now, likewise, there is on the other side the stroma or the mesenchymal element, which we also refer to as a supportive network, which is basically composed of fibroconnective tissue and blood vessels. Now, this provides the framework on which the parenchymal tumor cells start growing. Now, sometimes, apart from the benign and the cancer or the malignant tumors, we also have yet another category where the tumor cells are highly undifferentiated. So we refer to such a category as an undifferentiated malignant tumor category. Now, there are also other categories of tumor what we call as a specialized category of tumors. Now, under this, we have certain subtypes. To start with, the most important is a mixed category of tumor. As the name indicates, there are combinations of two types of tumors which can coexist in the same tissue or organ. For example, the endometrium is one such organ where you are able to appreciate an adenocarcinomatous component and a squamous cell carcinoma coexisting in the same organ, what we refer to as adenosquamous type of carcinoma. Yet another example is a carcinosarcoma where within the same tissue two types of cancers coexist as a combination. So one is a carcinomatous component carcinoma and the other one is a sarcoma, which is a mesenchymal tissue component. Now the second category is what we call as teratomas. Teratoma is basically made up of totipotent cells and it is having a mixture of tissue elements. So there are three types of germ cell layers, to name them: ectoderm, mesoderm and endoderm. Now if these teratomas are primarily seen originating in the ovaries and testes, when they originate in the ovaries, we recall them as gonadal teratomas, and when they arise in an extra gonadal site, for example in the midline of the body, especially in the head and neck region, or in the mediasternum or retroperitoneum or sacrococcygeal areas or regions, we call them as extragonadal teratomas. Now, whenever a testicular component is visible inside a teratoma, we call it as a malignant or immature category, while when we see the same teratomas arising in the ovaries, we call them as benign teratomas or mature teratomas. The next subtype is a blastoma. Blastoma is also referred to as embryomas. Now these blastomas are highly malignant tumors which are seen in a child who is less than 5 years of age group. Now these tumors basically arise from a partially differentiated or embryonal component which gives rise to a variety of subtypes. To name a few: neuroblastomas, retinoblastomas, hepatoblastomas, pulmonoblastomas and medulloblastomas. Now apart from this, we have two more categories what we call as hamartomas and corystoma. Hamartoma is a benign tumor which is basically made up of mature components, but the tumor is arranged in a disorganized pattern. The cells of tissues are indigenous to the site of origin, but they are present in a haphazard pattern of arrangement. So the best example for a hamartoma is lung. Hamartoma of lungs are common and it is basically made up of mature cartilage, smooth muscles and epithelium. Likewise, corystoma is another mixed category of tumor wherein it is referred to as an ectopic rest of tissue which is present in an abnormal location. Examples: pancreatic tissue present in a gut wall. So to conclude today's e-content series, so next class we will be discussing on the nomenclature and classification of tumors and their various parenchymatous type of cells and the various components from which every tumor is originating. Thank you.